Hello, everyone. Welcome again to another episode of the Legal Lunch Byte. Very happy to have you here. My name is Jonathan Bench. I'm a partner with Sliwoski's Salt Lake City office. Today, I'm joined by my colleague, Ethan Minkin. Ethan, I'm going to let you do your own introduction. Very happy to have you with me today. I always enjoy our chats, and I'm looking forward to learning from you today.
Yeah, it's great to be here. I'm in our Phoenix office. I practice primarily commercial litigation as well as healthcare, both healthcare regulatory, transactional, and litigation. And we're giving a presentation next week on a new healthcare topic, not a new healthcare topic, but a healthcare topic that's pretty hot right now.
Okay, so tell us about the webinar. I haven't been following it all, so you need to tell me what's the reason to tune in.
Well, the reason to tune in is that the OIG, Office of Inspector General, has released new healthcare compliance guidance for the industry. It's significant because the compliance guidance first came out in the 1990s, and there was a general compliance program, and then over time they did uh, compliance plans specific for different participants, medical groups, hospitals, home health agencies, and so on and so forth. There hasn't been any major updates until November 2023 when the new guidance came out. This year, they're supposed to start releasing industry specific guidance that's updated, including for Medicare Advantage plans and for nursing homes. And so it's a very timely topic.
So that sounds massive. I mean, decades since a big update and very wide sweeping guidance coming out.
Correct. And then I forgot to mention we're going to have two industry experts present with me, Shireen Honest and Ambika Kanta. Shireen and Ambika and I worked together. I was outside counsel to a healthcare entity, and they both worked for the healthcare entity. Shireen um, is an expert in designing compliance plans. She was a compliance director when I worked with her with that healthcare entity. She also has other expertise like revenue. I can never remember the whole word. I'm sorry, the whole phrase. It's revenue management essentially for provider groups. And Mika works on the quality side and medical management as well, and a few other areas. And she understands what it's like to implement a plan. And so they both bring a great perspective. They both spent their careers in healthcare, and I think they'll add a lot to the presentation.
Sounds excellent. So let's dive in a little more to the topic then. So before we talk about healthcare compliance plans, what laws are implicated that govern all of this? I mean, I know healthcare in any country is a massive, it's just a massive undertaking. So help orient us a little bit to the U.S. market.
Yeah, the U.S. market is incredibly complicated. I once heard, and I believe it's true, that healthcare is the second most regulated industry behind nuclear energy. There are three big laws at the federal level that come into play. There's the anti-kickback statute, the Stark laws, and false claims. The anti-kickback statute, from the broadest perspective, is you can't pay for referrals. Uh, the Stark law applies to physicians only, and they can't refer to an entity in which they have a financial interest or which their immediate relatives have a financial interest. False claims is what it sounds like. You can't submit a claim, for example, for services you haven't rendered. It gets much more complex than that, but that's a very easy example. And people may say, well, that never happens. It happens where people submit claims or physicians, providers for services they never provided. And that's just out and out fraud. And generally, those three laws are in place. There's policy reasons behind it, including controlling healthcare costs and quality of care as well. If you provide too many services, there's not always a corresponding quality improvement, right? And so there's policies behind the fraud and abuse laws that all the laws, in one way or another, reflect.
That's really interesting. I'm almost tempted to ask you. We didn't talk about this, but I'm tempted to throw you this curveball, which is how are we doing on improving access to care and quality of care and keeping costs down?
Those are great questions. The cost of care, I think most people would say, has not been controlled. Healthcare inflation, the last time I studied it, is well in excess of what general inflation is for the economy. Likewise, there's been a lot of studies about how much money we spend on fraud. And it's a lot. And I should back up 1 second. These laws generally get triggered if you take federal money. What does that mean? If you take Medicare, if you take Medicaid, if you take VA reimbursement, those are the kind of federal programs. And once you start taking that money, these laws come into play. And it's very, they're important, among other things. For example, the anti-kickback statute is criminal. You go to jail, right? The other laws have very severe financial penalties. And if you violate these laws, you can get debarred from the Medicare, Medicaid programs, which means you can't see those patients. And it's not atypical for, say, a hospital, let's say, that half of their revenue comes from federal programs. So
Wow.
it's significant, and it has other ramifications as well.
Yeah, fascinating. So, which agencies in the U.S. oversee this healthcare compliance programs?
As I mentioned in the beginning, there's the Office of Inspector General. It's housed in Health and Human Services. They do a lot of advisory services. They're the ones who publish the updated compliance guidance. They provide opinions about different issues. They provide fraud alerts. And so when the OIG speaks and you're in healthcare, you better listen. And then there's the Department of Justice, which has, the authority to prosecute cases. And those are really the two main entities, enforcement entities at the federal level.
I did do a summer at the U.S. Attorney's Office in Salt Lake City during law school in the white collar crime enforcement, and one of the cases that I worked on dealt with fraud and Medicaid fraud, I think. So I got a little window into it. It's interesting how creative people think they are sometimes.
Yeah, that's true. That's true. I've often said the most dangerous people in healthcare are the entrepreneurs because they have great ideas, but a lot of ideas that work in the regular business world don't work in healthcare.
Right.
Yeah.
So you had mentioned earlier about healthcare compliance plans. How, what are they and how important are they? Are they mandatory? Are they optional? Does it depend on the size of the, hospital system or the medical group? Can you give us some lay of the land there a bit?
Yeah, a compliance plan is a written document, and it outlines various issues specific to these different laws and risk areas and the like. But a healthcare compliance program has 7 elements, and I'll let Shireen and Ambika go through that next week. But for example, you need policies and procedures, right, that are tailored to your organization. And there's other requirements as well, including it has to be an effective compliance plan. In other words, you don't just write these things up, you come up with policies and procedures and you put them on a shelf and you're done. That's not an effective plan. It requires training of your workforce and regular updates to your workforce and so on and so forth. Is it mandatory? Generally, no. But providers are smart to adopt one. And the OIG recognizes there's a big difference between a compliance plan for a solo physician versus a large healthcare system. They have much different resources. They have much different risks. And so they can be tailored to the size of the organization. The important point, I think, is that these providers are cognizant of the various laws, the various risk areas, and they're proactive in terms of trying to root out any fraud in their practice.
So what would be some components of a compliance plan then? Is it more tailored toward care, kind of standards of care and meeting those, or is it more about making sure the finance and billing side is not opaque and is clearly, it's easy to root out fraud, for instance?
Yeah, it's more of the latter. But notwithstanding that, it impacts quality, right? As we discussed before, if you're providing too many services, medically unnecessary services, that could impact the quality of care for a patient. But that's, I think, more incidental for the most part to the other parts of the plan, which, as you said, you're looking at finance, you're looking at operations. Say you're a healthcare insurer, your claims payment, your claims processing department is incredibly important. There's software to try to root out fraud and abuse and the like. People often ask, well, how do people get caught with these, with fraud and abuse issues? I think the two most common ways are, first, you have whistleblowers. They see something, they don't like it, and they can take certain actions. And then secondarily, I think through audits, Medicare, Medicaid audits, they'll come in and they'll audit you for a variety of reasons, and they can pick up fraud or potential fraud through their audits. So there's a couple ways these issues typically come up.
So interesting. So what are the advantages then to having a compliance plan if they are not mandatory?
The major legal advantage is that under the federal sentencing guidelines, it's considered a mitigating factor. And so what does that mean? It can reduce the sentence, it can reduce financial penalties and the like. So it's smart to have a compliance plan from a legal perspective. And I just think it's also a good way of doing business, right? I mean, you don't want to submit false claims, right? You don't want to do things that compromise quality of care. You don't want to do things that, push up the cost of care for all of us. So I think there's both a business reason to do it as well as a legal reason to do it.
Yeah, that makes great sense. So we've got a couple minutes left. Is there anything in the compliance guidance that is new or maybe that was unexpected from your perspective? You said it's been years since there's been an update. I mean, technology has changed a lot in the last 30 years.
Yes, and you nailed one of the issues. It's looking at tech companies that have entered this space as one of the major new issues, as well as private equity that's entered the healthcare space, and they each have potential risk involved for a variety of reasons. And so the OIG has highlighted those as emerging issues, and I think when we start to see the individualized compliance plans for the various industry participants, we'll see a lot more discussion of these emerging issues.
So interesting. Is there any indication of any terms about AI or blockchain? I'm in those spaces a lot, and so that practice cuts across a lot of different things into fintech. Kind of the immutability of records on blockchain. There are a lot of players trying to innovate in the space, including in healthcare. So have you read anything at all about looking at these very nascent technologies?
I wouldn't call myself an expert in those areas, but yes, those are areas I think the OIG is concerned about using AI. I mean, for example, for a long time, there's been upcoding in the industry where providers try to figure out, how do I code to get the most out of, this visit. Then you have on the payer side, they have their software to down code, right? And we shouldn't be paying for this, and this. We should be paying for that, or we should be using different coding and so on and so forth. So IT has always been a part of healthcare, but as you noted, there's a lot of emerging, IT in this space, and it presents various risks.
Yeah, that's excellent. I'm looking forward to keeping an eye on this. So any parting thoughts then, Ethan, about either about the webinar or about your practice in general?
Nothing in particular. I just think that if you're involved in the healthcare industry and you want to stay current on some very important topics, I think next week will be a good chance to really get a good lay of the land of what's going on with the compliance plans these days, and hearing from people who deal with this on a regular basis. And that to me is very important, right?
Yeah,
Because
I
they
assume you'd be happy to have input, right? I mean, Q&A, you probably have a Q&A portion, and it's always fun to see what kind of questions come that you haven't anticipated at all.
Yeah, I agree.
Excellent. Well, thanks everyone for tuning in again this week. We look forward to seeing you next week. We're going to take a radical turn and go to India to meet with Kunal Mehra, who will be giving us a lay of the land on what's going on in India as a lot of companies look to pivot from China. And it'll be fun to get that view on the market. So we look forward to catching up with you again next week.